Welcome to Medicine Handy Points. Today, our topic of discussion is hepatitis B virus infection and its treatment protocol. We'll address the confusing points in the treatment protocol, so let's discuss that. Now, if the patient turn out to be hepatitis B surface antigen positive, so what should be the next steps? The next step we can do is to do hepatitis E antigen. And if the hepatitis E antigen is positive, we will do PCR, hepatitis B virus DNA PCR. And if the PCR is more than 20,000 copies international unit and ALT is more than two times the upper limit of normal, this patient now applies for treatment. So we'll start the treatment. Now, on the other hand, if the hepatitis E antigen is negative and PCR shows that the copies are more than 2000 and the ALT is more than two times the upper limit of normal, now again this patient will need treatment. Now, the question is, where is the difference? The difference is that in a positive situation of hepatitis E antigen, we start treatment only if the PCR shows more than 20,000 international unit copies and ALT is more than two times the upper limit of normal. On the other hand, if the hepatitis E antigen is negative and the copies are more than 2000, we start the treatment when the ALT is more than two times the upper limit of normal. So all these points has to be met. Copies and ALT levels, both in the negative patient and in the positive patient. These has to be met before the treatment is started. Now, the next thing is that if what ALT is 1 to 2 times the upper limit of normal, what should we do then? In that case, we can do a fibroscan or biopsy, mostly fibroscan. If it shows fibrosis, then we should start the treatment to prevent further progression of the disease. However, if ALT is one time the upper limit of normal, then we look at the hepatitis B surface antigen levels. If the levels are more than 1000 international unit, we do ALT every 6 monthly and fibroscan every 2 years. uh, and if their ALT is rising and fibroscan shows fibrosis, we start the treatment. However, if the hepatitis B surface antigen level are less than 1000, we do ALT every 12 months and fibroscan every 3 years. And if there is any deterioration, we do start the treatment. Now, what is the treatment? There are two drugs, tenofovir and entecavir. So, both of them can be given, but mostly one of them is given, not both of them, but it depend on the patient preferences and local availability. Now, Now, if hepatitis, we have started the treatment. Now, when to stop the treatment? In hepatitis E positive category, patient gets seroconverted to hepatitis E negativity after successful treatment. So, this is called seroconversion when hepatitis E antigen gets converted to negativity. So, after seroconversion, we will continue the treatment for 1 more year and then we can stop it. But then we have to do follow up monitoring of the patient as well. In hepatitis E negative category, we should never stop the treatment because there is no clear cut point when we should stop the treatment. Maybe the virus is there and it is replicating and we may not we may miss it, so we can should never stop the treatment. They should in fact take the treatment lifelong. In some of the literature and guidelines, they suggested treating these patients lifelong. Now, there are a few exceptions. The previous rules which we discussed does not apply to surgeons who have hepatitis B infection because they are involved in surgeries. They can transmit it to the patient. So the once a surgeon is positive, hepatitis B surface antigen positive, and there are copies even 300, they should be treated, and the treatment should be done irrespective of hepatitis B DNA copies in ALT's level, and ideally the hepatitis B DNA copy should be kept below 200. Now, in case of compensated and decompensated cirrhosis, treat irrespective of ALT and hepatitis B virus DNA because hepatitis B infection, if treated, actually can reverse the cirrhosis and fibrosis. So, and they should be treated lifelong. Ultrasound of these patients should be done every 6 monthly because there are high chances of hepatocellular carcinoma in these patients, and they should be also evaluated for liver transplantation as well. Thank you so much for watching. I hope I have clarified a lot of points, and please subscribe to the channel. Thank you.